So let's go on here. We're going to talk about efficiency techniques to make your office work smoother. For a couple of these, I asked my staff because my office does work smooth. It's usually not due to me, but due to them. So I'll talk about a few things here. How to make your visit work better with appropriate preparation, how to streamline the office visit to reduce time vampires. So I got this title of time vampires from Dan Kennedy. He's one of my favorite marketing guys. And he talks about we want to get rid of these like things that suck our life away from us. Actually, my favorite tip before I even get going is if I have a patient that's like sucking the life out of me, I have two ways I can call my staff. One is I open up the door and they'll come in and see if I need anything, and I have a little buzzer. These little buzzers where I just put it's kind of in a hidden location and they can come and get me and rescue me. Usually I do it to just request if I need like a walking boot or something like that. So how to simplify after visit communication and sharing patient education content. So I'm doing these for the AAPPM, but I'm going to give this to you as well. So I think there's three areas in our patient encounter we want to talk about. One is before the visit, one is during the visit, and one is after the visit. These are all ways that we can increase efficiency. So before the visit, how to make the patient visit work better with appropriate preparation before. Okay. Use the website. So these are some tips I have. So once again, making the appointment, that's great. You make the appointment, you schedule it. Some obvious things, but you want to check the referral, make sure the referral is in there. Check coverage. Some doctors check DME all the time and what's covered. We do not do that. We know we have a list of insurances and we have ones that we know that they cover certain things, but we don't check always the deductible. I want to be clear about that. But some doctors do. What other things you can do before the visit? My favorite patients are the ones that have like binge watched all of my YouTube videos or gone to the website and they've read every section on a certain condition. So what can we do then to get our patients to our website before they come into the office? So this is key. So if you're going to send out some information or whatever to ask them to sign up or things like that, you could send them an email and say, hey, here is some information about our website prior to you coming in. So you could have like a before your visit information pack in there. I call it a welcome packet. It can be anything that you want, but you could have different sections on the most common conditions they see. So for example, plantar fasciitis, Achilles tendonitis, you could have some information. You can even put that on that section of your website. Some people are concerned that if they give away everything, like if they learn everything, they won't come in. And I find that is absolutely incorrect. If patients are going to get better on their own, they're not going to make an appointment with you anyway. And you want to have the best information that's out there. So I try to give everything away. I have lectures, I have webinars. And once again, my patients that come in, they're not going to be able to do shockwave on their own. And I don't mind if they're already on second base, if they've already tried foam rolling, if they've already tried a night splint or stretching or things like that, then I just jump right to the next step. So my best patients are the informed patients before they come in. So if I can get everyone a specific video or a specific web page for their condition when they come in and make the appointment, that would be great. Like if they made the appointment for an ingrown toenail, my staff would send them our page on ingrown toenails or plantar fasciitis. But a lot of times the patients don't know what they have. Also give them information about the doctor, such as testimonials, welcome video, and a welcome book. When our patients register on the iPad thingy, then it has a little bio of us, but the more the information they can get about the doctor, the better, because they want to know who they're seeing. And once again, this is positioning, so something that's going to include online reviews and other patient experiences, because they're going to Google you whether you know it or not. They're going to Google your name. Have them fill out the paperwork before. We have two systems. Actually, it's the same system. It's called Epion. And it sends them a text message and they can fill it out on their phone, or when they come in, they can use the iPad to fill out the same thing. But if they do it before, it makes it easier. This is the iPad to make the check-in. So we have these digital check-ins that's on their phone and on the iPad. And we have multiple iPads, not just one kiosk. So make sure the referral is completed. So the bonus, I know it sounds obvious, but patients over the age of 50, I'm getting there here soon. Patients over the age of 50, they're older. Use the staff to fill it out for them. Ask them the questions. The staff will fill it out. Just makes it a lot easier. And then the extra bonus, if this is because this lecture is for staff, put butts in the treatment rooms versus waiting and stressing out the doctors. I know if you're like me, you get stressed when you're just kind of waiting there, twiddling your thumbs, and they're waiting to get the patients in the room. They can't even start the X-rays on them. Okay, so those are some additional tips before. This is an example of the app that we use, and it kind of shows how much they owe. They can pay their copay. They can do other things like that. This is the app. So basically, they can sign things. They can do everything on this app or on their cell phone. So during the visit, how to streamline the office visit to reduce the time vampires. I'm going to talk about a few of my pet peeves, some of the vampires. The number one thing is we try not to leave the treatment room. So we have a pager system and the open door system. So the pager system, I bought these little circles. We have 6 of them in each treatment room. You click it, it says, it has a little thing where the staff stand, ding, room 3 needs assistance. And that's how it goes. And when I have little kids in the room, I pretend like I do a magic trick for them. So I pretend I hit the button and I say, now I'm just going to think really hard about having my staff come, and they come and open up the door and they're amazed with that little magic trick. But if you want to do magic tricks, that's a good one. So a few things that should be pre-injected. This is what we do. We pre-draw up the injections, pre-drop cortisone, and the staff just gets them. So if we need that, we just ding them. They'll get the ultrasound ready. They'll get the injection ready. They'll get the scan ready for the orthotics. They'll get X-rays. So try not to leave the room for X-rays. Many times what I'll do is if they didn't get X-rays, so 99% of my time, my staff get X-rays before they see, because I've trained them when they should get them. Pretty much everything with pain, they'll get X-rays. Do they sometimes do a few more than they need? Yes, but it's better to have a few more than have me wait around and have them not done. For ultrasounds, usually I'll save. So for example, the first visit with plantar fasciitis, I'll get an X-ray, and then I'll do some things, and then the follow-up, we'll do the ultrasound. So I'll actually book it so that the ultrasound will be in the room or be ready with their patient information in there. We have a frequently asked question staff document. So anytime a staff asks you something that's repetitive, you can put it in that document so you don't have to bother the doctor. Our staff uses OneNote, Microsoft OneNote, and then they can share that amongst each other, amongst the different staff members. So when a new staff joins, they can really get them up to speed real quick with this kind of universal OneNote that we have. Don't waste time looking for an X-ray, get new X-rays. We have these like archaic, so our computers don't have CD-ROMs on purpose because we can't look at X-rays that come. We have this old archaic laptop that we can sometimes put X-rays in, but I always have to breathe deep before I do that. I tend to always encourage patients to always get new X-rays. And I usually use the explanation that yours were probably non-weight bearing. These are going to be weight bearing. That's my biggest rationale. Also, in terms of orthotics and AFOs, we tend to scan more for orthotics because it takes 30 seconds versus the traditional 5 or 10 minutes with plaster casting. So those are ways to save time during the patient visit. We develop protocols in our office. I'm sure everyone has these. I'll show you ours in a little bit, but protocols of what we do for warts, for ulcers, for nails, for casting, for uniboots. I think it's, now it doesn't work this way in my office, but I think it's better to have the office way versus the individual doctor way. I think that the office should do ingrown toenails and do the bandage this way versus like, oh, you have Dr. Saviette's way with Coban and my ways with tape and things like that. But that's not always the case between partners. We use index cards or pictures as reference for staff. Here's some examples. You can see here, Uniboot, Matrix, IND, nail avulsion follow-up. And they have different HPI, what they should put in. Matrix, when you prep for toes, IND, post-op, wart follow-up, lesion excision, exostectomy, Matrix, IND, paronychia. So Matrix BS, that's Ben. His is different than ours. An ulcer follow-up. This is a funny thing. So we use tape when we do these ingrown toenails. So we have 2 different tape lengths because it's the biggest pet peeve when they have like this huge piece of tape. So we actually have the tape and the toe sock and everything kind of so they know what size they need. So for staff, we recommend they do imaging before the doctor arrives. And then when in doubt, get X-rays. Schedule other imaging and procedures next visit. This is something I'm pretty good at doing. So many times when patients are coming back, so I'll say, okay, we're going to try some treatments here for your plantar fasciitis. At the next visit, we'll do the ultrasound. So I'll book it and the ultrasound will be ready. Next visit, I'll do the Cariflex because Cariflex takes me a long time. Sometimes if I have time and absolutely want it that same day, I'll do it. But I'll schedule those. X-rays as well. If I'm running behind and they forgot to get them and it's not going to change my treatment, I will get X-rays the next visit. Shockwave. So something I frequently schedule is this. So shockwave and 3 sessions, shockwave times 3 sessions with ultrasound at the first session and then amnio at the second, for example. That's what I do typically. I write that in my notes section when I'm kind of handing it off for the next appointment. That'll save me a lot of time with that. Some doctor's visits suggestions. So my number one doctor recommendation to not get sucked into the time vampires is to have a scribe. I've talked about that a lot. I have Morali. He's in my pocket with me all day. He's a virtual scribe. 8 hours a day with me. It is by far my biggest expense, but it also makes me much, much more productive in the office. I wouldn't, and also more just peace of mind. And so I review the x-rays with Morali before I see the patient. So I review the x-rays and I document the x-rays. Occasionally there's a few changes if based on what I'm seeing on the physical exam, but for the most part, I review x-rays before seeing the patient. I use a scribe to help. Now this scribe does more than documentation. He doesn't do just the HPI. He does the physical exam. He does all of the, he does everything for me. He orders medications. He schedules surgeries. So the way I do that with surgery, I have a Google Doc with like the top 10 surgeries that I do. He just copies and pastes it and sends it to my office manager. He sends stuff to the staff bucket to check for DME, so checking for AFOs, coverage, things like that. He'll review the lab results for like a nail sample and say the doctor will review it at the next visit. He does all these things. So that's my number one suggestion. So if I could pick one thing for you to do, would be investing in a scribe. That's made my life 10 times better. These two other things are things that I've developed that have really made my life better. So let me just explain. There's kind of two things that I have. One is called patient presentations, and the other one's called treatment sheets. If you haven't heard about them, they're like my saving grace. Let me explain. The patient presentations are basically just PowerPoint slides or Google Slides that I share my patients on different conditions if I want to explain it in more detail. Now, if I'm running behind, sometimes I will only use my treatment sheet. There's one that goes in my pocket, and there's another one that I can print out depending on the condition and how specific it is. The ones in my pocket are just a generic musculoskeletal one, but I'll kind of explain how I use that in a second. And then a nail sample and pathology with a sticky note. I know this sounds funny, but in our treatment, in our office, we put little sticky notes, patients' first name and what they're there for to trigger us, because I'm not looking at the computer every time. I look much less now that I have my scribe. And so they'll just say what's going on, and I'll actually ask my scribe, what were they here for last time? What do they need this time? And he'll just look at the note and tell me. Much easier for me. So for nail samples, when I do nail samples or pathology, that sticky note, I just put it on the nail sample so they can fill out things there. So that's all done. It just saves it a lot of time because I do so many nail samples. Another quick suggestion is when patients ask for their x-rays, I just have them take a picture with their cell phone. So versus giving them the whole CD and things like that. So here's an example of my patient presentation. So if you want to look at this, you can go to patientpresentations.com if you want to learn more. But this is the actual presentation that I use. It's the slides on nail fungus. I talk about what their expectations are, my pathology report, my recommendations, the liver concern, things that people have. So this all you can see if you want. I don't always use this. It really depends on how I'm not really behind, but how much information they want. I always thought in the past that patients wanted a ton of information, and some patients want a lot, and others just kind of want you to do it for them. So I don't always use this for patients. Okay, but I do have this on a blog where it's me going through it and talking through the slide deck, and so they have that and they have everything written down if they want to review it. This is what I call a treatment sheet, which is attached. So let me just go back here. So if you look at this previous one here on this first slide, usually on the first slide, I have something up in the corner that's called treatment sheet. So you can get this treatment sheet right from the presentation. Now, I don't tend to do this. My staff tends to print it out for me. And this is what the treatment sheet looks like. This is what helps me for nail fungus and for most of my conditions to do so much of the ancillary products. And I'll kind of go how I do this. So I do the first visit, I do the nail sample. I have them review my video. Here's the video right here that they review. At the second visit, I have them review the results. If it's susceptible to oral medication and that's what they want, I'll do that. I'll have them do LFTs. Here's the 2 locations of the labs where I'll send it to. Here's the oral antifungal. I also recommend them use biotin, iron, and zinc. That's going to help the nails grow faster. So they get 2 bottles of this. I do the one that's from Baco. That's the one that I use. They get 2 bottles of that. They get the oral pills. And then they get these other things I'll tell you about in a second. At the third visit, I do a booster dose, which is they get this for 90 days. And then when they come back in, I give them another 90 days, but they do a really low dose once a week for 25 weeks and then back to once a day. That's just the way I do it. That's the way it's worked for me. If you have a different way that's better, let me know. I do not keep them on the full dose for the whole like 9 months or a year. Once everything's gone, I tend to have them use a topical antifungal once a week. I use this thing that's written about laser here as a positioning technique. I don't do much laser. I have 3 lasers. I wish they worked on nail fungus. I just really don't believe it. And so I don't do much laser. I'm usually talking to people more out of laser than into laser. But the positioning technique is the following. We're not going to do laser. Laser would cost you $1,500. Okay, so, and I don't think it's as effective. So when I say $1,500, that anchors them to 1,500. And what that means is then when I tell them, okay, the UV light and this pills, all this will cost you about $200. And they're like, okay, 200 is nothing compared to 1,500. If anyone in your household has similar complaints, they should be evaluated. Remember, the nails grow 1 millimeter per month. So this is the way I get other family members. This is the way I kind of put expectations. And then I have a prevention. And I actually explain how they use things. And this has really helped me. So for the UV light, they do that once a month. Antifungal shoe spray once a week. Wash towels, alternate shoes, and disinfect the shower. So here's the whole process. So medication, biotin daily, antifungal shoe spray weekly, and the antifungal UV light monthly. So it's all kind of written out for them, and everyone gets all the stuff. I use whatever UV light is available. It used to be Shoes app. Now it's the other one that's out there. And then same thing with shoe spray, whatever one's available through the company. I do not put name brands on here just because my products change. Streamlining the post-visit plans as well. So for fungal nails, they will get a medication, biotin daily, the shoe spray weekly, and then the sterilizer monthly. This is something that's important for post-op plans. For the calluses, I teach them how to use this, right? The urea cream daily, Pummy bar, actually it's usually weekly, and the Calisox daily. So you want to explain why and how to use them. This has really helped me for increasing my dispensing of things, because in the past I just used to say, oh, get the nights, but now I have a whole process. So for my Pelto special, which is what most people with Aquinas get, which pretty much is everyone that comes in with plantar fasciitis or Achilles tendonitis, they're going to get a morning stretch with a towel, foam roller. We'll teach them how to do that in the morning for 3 minutes, foam rolling at night, and then a night splint for 3 hours in the evening. So either when they're sleeping or when they're resting. Other post-op plans, matrixectomy, collagen, and different handouts. So streamline checkout procedures. We have a billing tab in our EMR. And so my scribe will type in what they need, what they're purchasing, what they're getting, so they don't have to take paper with them anymore. So it's all kind of written in there. Put that in the memo section. I avoid walking patients out. In the past, we used to walk patients out. Now I just go right to the next treatment room. Okay. I used to try to walk them out and verbally tell the staff, but the staff are always like on the phone or checking someone else out. And another big key is having different packages. So I do a lot of packages, and if patients prepay for a package, they get 10% off. That's just and the staff just has something to say there. So they can say, okay, you can do Swifts one at a time. They're $250 a time, or you can, do all 4 and you get 10% off. And everyone asks me, what happens if they get better before? We'll just refund them those sessions. That's fine. We can do 3 shockwave treatments with an ultrasound. We'll do a 3-month matrixectomy. We'll do a yearly vascular study and diabetic foot exam. So these are things that I do to kind of streamline and the staff know. And then finally, after the visit, how can you streamline things? How to simplify after visit communication and sharing educational content. Once again, using your website or email to share patient education resources. I'm a big advocate of videos. We have a blog that has a video section on top and then the written section of the blog underneath it. This really helps us out. So I have 1 page on each condition that I treat that I share with patients. It's currently not the one that they can get information about the condition. It's actually a different page, but maybe I should put a link to that page. That would make sense. And then I also include a review request and when I'm sending out patient education information. I think that the after communication with the treatment sheets really, really helps. And I always circle what I'm going to do at the next visit. So I'm planning. So I see them, and then I say at the next visit, if you're not better, I'm going to circle like physical therapy. I'm going to circle orthotics or circle on these treatment sheets that I'm going to be using. That's something that really helps me out. Also, I have a printed page of all the patients that come in. I have a little list on my desk, and if I want to call someone the next day, I highlight it. I have a little highlighter. I highlight that patient. Sometimes you want to call someone, for example, a patient I did an injection for gout, and I'm wondering if they're doing better. I'll give them a call or have my staff give them a call the next day. These are my foot treatment checklists. This is rendition like 2 or 3. Only word to the wise, if you want to copy this, go ahead, but don't print out like 10,000 like I did, because I had a spelling error on this, and I had like 10,000 of these. I'm still trying to get through, and also my texting phone number doesn't work either anymore. So, but I still have a lot of these left. So if you're gonna do it, do very few in the beginning. I set mine up, their name, date, when the next appointment is. So once again, I check what I do that day. So I actually do this in front of them. I check, okay, did the x-rays today? It showed this. If it doesn't get better, the next visit we'll do ultrasound, we'll do shockwave. I check off, we did an anti-inflammatory, we're going to do icing, we're going to do a contrast bath. This is my typical thing. So you're going to get meloxicam, icing, or contrast baths. I said, we're not going to do a cortisone. I'm going to send you patient education information. I want you to review it. And my scribe will send that to them. I'm going to have you do the system. The system is, I usually number this. So number 1 is a towel stretch for 3 minutes. Number 2 is foam rolling. I put 2 to 3 minutes. I always cross that off. And then number 3 would be the night splint. And then I'll circle like physical therapy would be next. And on the backside, you got shoe recommendations and what we did for them that day. So this is the one that I use every single day for like musculoskeletal things. And then you can have the one that I just showed you before. They're single pages. What my staff tend to do is they print out the most common one. So I have one for this. I have one for the last shockwave visit. The last shockwave visit is one just goes over the plan, what's next. So at the last shockwave, so I can bill an office visit that last shockwave versus just the shockwave. So it kind of says that if it's not getting better, we'll do an ultrasound next. We might do more shockwave. We might do, other types of things. So that's the way I can do more office visits. Okay, this one is done, and I'll be back. There's going to be one more.